Have you ever gotten a medical report and felt like you were trying to read, I don't know, a completely foreign language? Well, today we're going to decode the one for mammograms. It's a system called BI-RADS, and it's the amazing tool that helps turn a really complex image into a clear path forward for your health.
Okay, so let's just dive right in. Imagine you're a radiologist, and this image pops up on your screen. What you're looking for is something called architectural distortion, and let me tell you, it's one of the most subtle and challenging things to spot.
So that begs the question, right? How on earth do doctors take this complicated, grayscale picture and turn it into a clear diagnosis, and more importantly, a plan of action? Well, the answer is in this really powerful standardized system that's designed to do exactly that, to create clarity out of all this complexity. All right, so here's our game plan for today. We're going to start with why BI-RADS even matters in the first place. Then we'll get into the fun stuff, decoding what radiologists are actually looking for. We'll figure out how to spot the difference between benign and suspicious signs. We'll go through the all-important scoring system, and then we'll put it all together in a real-world example. So first things first, why does BI-RADS matter? Well, it all comes down to the need for a universal language in medicine. So what is BI-RADS? It actually stands for the Breast Imaging Reporting and Data System. I want you to think of it like a universal playbook created by the American College of Radiology. Its whole purpose is to make sure every single doctor is describing and scoring a mammogram in the exact same way. And its goals? They're crystal clear. Standardize the language, cut down on confusion, make sure doctors can communicate with each other reliably. And it even helps with research down the line. This system means that a radiologist in New York is speaking the exact same language as one in California. It's all about consistency. Okay, so now we know why this system exists. Let's start learning the language itself. It's time to decode what's called the radiologist lexicon. These are the specific things they're trained to hunt for. Hey, remember that very first image we looked at? Here it is again. Architectural distortion. You can kind of see how the tissue looks like it's being pulled or puckered, but there's no obvious lump or mass. It's incredibly subtle, and if a patient hasn't had surgery before, a finding like this is immediately suspicious. All right, next up is something called a focal asymmetry. See that little area of dense tissue? It's showing up on two different mammogram views. Now, if an asymmetry has been there for years and hasn't changed, it might be totally fine, but a developing asymmetry, one that's new or bigger than the last exam, oh, that's a major red flag. And just how big of a red flag are we talking about? Well, roughly 15% of these developing asymmetries turn out to be malignant. And that is why spotting them and reporting them using this standardized language is so critical. So much of this is about telling the difference between what's normal and what's a potential red flag. And there's no better example of this than calcifications. These show us exactly how radiologists learn to separate what's likely harmless from what's really concerning. So calcifications are just these tiny little deposits of calcium in the breast tissue, and they're super common. But here's the kicker. Their shape and their pattern tell a whole story. The benign ones, they're usually bigger, kind of chunky, with smooth round shapes. But suspicious ones, they're different. They're often fine, irregular, and can look like tiny branching lines. And when you see them side by side like this, wow, the difference is just night and day. On the left, you've got these classic, benign, popcorn-like calcifications. Totally harmless. But on the right, those are the suspicious, fine linear branching ones we were just talking about. The picture really says it all. So why are those tiny lines so worrying? Well, this quote from the source material just explains it perfectly. Their appearance suggests filling of the lumen of a duct involved irregularly by breast cancer. The lumen is just the inside space of a milk duct. So what this is saying is that these calcifications are basically tracing the path of a potential cancer as it grows inside that duct. It's like a roadmap. Okay, so the radiologist has spotted the distortions, they've analyzed the asymmetries and the calcifications. How do they put all these clues together to make a final call? Well, that's where the assessment categories come in. This is the final score. The whole system boils down to a number from 0 to 6. 0 just means they need more pictures. 1 and 2, that's the all clear, negative or benign, routine screening. 3 is probably benign. This can be a stressful one because it's kind of a watch and wait situation, but it means there's a less than 2% chance of cancer, so they suggest a short-term follow-up. But then we get to 4 and 5 and things get serious. 4 is suspicious, and a biopsy should be on the table. 5 is highly suggestive of malignancy. A biopsy is absolutely critical here. And 6 is just for a known cancer that's already been proven, usually for tracking it during treatment. And it's also really important to mention a key update in the system. B-RADS now separates the assessment, that's the final number, from the management, which is the doctor's recommendation. This just gives doctors a lot more flexibility to tailor patient care based on the entire clinical picture, not just the image alone. All right, enough theory. Let's see how this all comes together in the real world. In this last section, we're going to put B-RADS into action and go from a single image all the way to the final interpretation. Okay, take a good look at this mammogram. You can pretty clearly see two different masses right next to each other. Over on the left, there's a smooth, oval-shaped one. But on the right, you see that irregular, kind of spiky-looking one? So, time for a pop quiz. Based on everything we've just learned about shapes and margins and all that, what do you think? What would the assessment be for that irregular, spiky mass on the right? If you guessed B-RADS 5, you are absolutely right. The finding is an irregular mass with what are called spiculated margins. That's a classic sign that is highly suggestive of malignancy. The smooth one next to it, on the other hand, has features that make it much more likely to be benign. And this just shows how radiologists assess every single finding on its own merits. And that, right there, is the real power of this system. From one complex image with a couple of different findings, B-RADS creates this clear, consistent, and actionable pathway that leads directly to patient care. It's the bridge that connects what they see to what they do next. So, what's the big takeaway from all this? Well, B-RADS is an absolutely incredible tool for turning complexity into clarity. But it does leave us with one final really important question. What happens when a case just doesn't fit neatly into one of the boxes? And that's when we're reminded that the radiologist's expertise and judgment, the art of medicine, is every bit as vital as the science of the system itself.